The content of this video is not medical advice or a substitute for physical therapy. Please consult your physician or physical therapist before starting any exercise program.
Today I want to share with you a couple of exercises that you can use to give some tight shoulders, specifically those muscles in the front of your shoulders and chest, a little bit of relief while also getting a little bit more movement in your rear ribs. So this is really important for those of us who are doing a lot of front work during the day, which is most of us. And what I call front work is essentially everything from working at your computer to driving your car to preparing food or even holding an infant. So for all my new parents and grandparents out there who are holding babies and feeding babies and you aren't used to doing that, a lot of you are telling me that you're feeling a lot of tightness in the front of your shoulders, and it shows itself when you go to reach for something. So whether you're reaching forward or upward or even behind you, you might feel some little tweaks and pains that you weren't feeling before. So these two exercises will really help you get over those little tweaks and pains. Now, I'm using a foam roller today, which I know most people actually have one of these in their home. Some of them aren't as soft as this one. So what I invite you to do if you want to soften your roller is put a folded blanket or something along it to soften it. You can use a beach towel or folded blanket, just something to give you a little bit of extra cushion if you find your roller is a little firm and inhospitable. So for our first exercise, you're going to want to place your roller so that it's perpendicular to your body. Next, you're going to lean back on your roller so that it's right across the bottom of your shoulder blades, and then you'll take your hands behind your head to support the weight of your head, but really try to keep your head aligned with the rest of your spine. Now, what you're going to do next is just gently backward bend over the roller. Now, to be clear here, I'm just backward bending with my rib cage area, my upper back area. I'm not going into my lower back, and hopefully you can see I'm not going into a big backward bend. I'm just trying to reestablish a little bit of this backward bending motion in the rib cage. Now, once I'm done with this area, I'm going to scoot my bottom toward my heels a little bit. That rolls the roller up my back, and I'm going to repeat this gentle backward bending. And you can see I just backward bend a moment, and then I come back up to my start position. I repeat that 2 or 3 times, and then I'm going to scoot my bottom down again. So you can work your way up your rear ribs here, and you're just trying to get a little bit more movement along your upper back where it tends to get really stiff throughout your work day or your activity-filled day. So you're going to work your way along your shoulder blade, making sure that you're not going above your shoulder blade, which would put you onto your neck, or below your shoulder blades, which could get you into the realm of your lower back. So we want to keep this kind of along that distance of the shoulder blade, making sure all the backward bending is along that thoracic spine area where your ribs are. In our next pattern, we're going to take the roller and make it more parallel to the body, and I'll ask you to sit on your roller and lie back so that your head is completely supported at one end of the roller and your tailbone is supported at the other end. You're going to place your arms into kind of an A-frame along your sides with your palms up. And what you should automatically feel is that just gravity is going to help you open up the fronts of the shoulders and your chest a little bit here. But to help it along, what we're going to do is gently draw the upper arms down toward the floor. And you'll feel that kind of broaden your collarbones, and maybe even you'll feel your shoulder blades flattening on your rear ribs a little bit. So this isn't a big motion. You don't need to grip or squeeze or crush anything. You're just kind of opening here. So you'll hold that position for a couple of seconds and then ease off. You can kind of follow your breath here. So as you exhale, you might draw the upper arms down toward the floor. Hold just for a moment, feeling the collarbones broaden and the shoulder blades flatten on those rear ribs, and then release. So you repeat that 2 or 3 times, and then you can start to march the arms outward a little bit. So you can repeat it in this sort of wider A position and even go all the way up to a T as long as this feels good. So once again, you should never experience pain or strain here. If you do, this is not your exercise. Now, the other thing I would like to note is that if that's too much stretch for you, if it feels like it's opening too much. You could also do this on a half roller, which would be lower to the ground, or even flat on the floor. So this particular exercise has a number of ways that you can do it. We just find that the roller can be really helpful for a lot of folks. So I hope you enjoyed this tip. I hope you find these helpful to you. If so, please share. We really appreciate that. And then of course, hit like, and if you haven't done it yet, hit the subscribe button so you can get these tips every week. Until next time, keep moving and be well.